When taking Colazal, it's important to follow your doctor's instructions. Usually, you'll take this medication 3 times a day, with or without food. Make sure to drink plenty of fluids while taking Colazal, unless your doctor tells you otherwise, as this can help prevent kidney stones. If you have trouble swallowing the capsules, you can open them and sprinkle the contents onto a spoonful of applesauce, then swallow it right away. It's important to take this medication regularly to get the most benefit from it, so try to take it at the same times each day. If your condition doesn't improve or gets worse, be sure to let your doctor know. If you experience headache, nausea, vomiting, joint pain, diarrhea, abdominal pain, fever, sore throat, trouble sleeping, or loss of appetite, it is important to let your doctor or pharmacist know. However, many people using Colazal do not experience serious side effects. Rarely, Colazal can worsen ulcerative colitis. If you notice increased abdominal pain or rectal bleeding after starting this medication, tell your doctor right away. It is important to report any serious side effects to your doctor, such as nausea/vomiting that doesn't stop, signs of kidney problems, yellowing eyes/skin, dark urine, unusual/extreme tiredness, severe stomach/abdominal pain, burning/painful urination, or fast/pounding heartbeat. While a serious allergic reaction to Colazal is rare, seek medical help immediately if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Before taking Colazal, it's important to talk to your doctor or pharmacist if you have any allergies to balsalazide, other aminosalicylates, salicylates, or sulfasalazine. This medication may contain inactive ingredients that could cause allergic reactions, so be sure to discuss any allergies with your pharmacist. It's also important to share your medical history with your doctor or pharmacist, especially if you have a certain stomach or intestinal condition, liver disease, or kidney disease. Colazal may make you more sensitive to the sun, especially if you have skin problems like atopic dermatitis or eczema. It's best to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you get sunburned or have skin blisters or redness, be sure to tell your doctor right away. If you are planning to have surgery, it's important to let your doctor or dentist know about all the medications and products you use, including prescription drugs, non-prescription drugs, and herbal products. This medication contains sodium, so it's important to consult your doctor or pharmacist if you are on a salt-restricted diet or if you have a condition that could be worsened by an increase in salt intake, such as heart failure. For children and teenagers younger than 18 years, it's important to avoid taking aspirin if they have chickenpox, flu, or any undiagnosed illness, or if they have recently received a vaccine. In these cases, taking aspirin increases the risk of Reye syndrome, a rare but serious illness. If you are pregnant, it's important to use this medication only when clearly needed and discuss the risks and benefits with your doctor. And if you are breastfeeding, be sure to consult your doctor before using Colazal. When taking Colazal, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's essential to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. One specific product that may interact with Colazal is dichlorphenamide. It's important to note that balsalazide, the active ingredient in Colazal, is very similar to mesalamine. Therefore, it's crucial to avoid using mesalamine medications taken by mouth while using balsalazide. Additionally, Colazal may interfere with certain lab tests, such as urine norepinephrine levels, potentially leading to false test results. It's important to inform lab personnel and all your doctors that you are using Colazal. As for the optimal timing and daily dosage of Colazal, it's best to follow your doctor's recommendations. They will provide specific instructions on when and how to take the medication, as well as the appropriate dosage for your individual needs. If you suspect an overdose and see serious symptoms like passing out or difficulty breathing, it's crucial to call for emergency assistance right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. Residents in Canada should call a provincial poison control centre. It's important not to share Colazal with others. Your doctor may also schedule lab tests to monitor your kidney and liver function while you are taking this medication. Be sure to attend all medical and lab appointments as recommended by your doctor. If you have any questions or concerns, consult your doctor for more information. If you forget to take a dose of Colazal, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It is important to store Colazal at room temperature, away from light and moisture. It should not be stored in the bathroom and should be kept out of reach of children and pets. It is important to not flush Colazal down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, it should be properly discarded. It is recommended to consult a pharmacist or local waste disposal company for guidance on how to dispose of Colazal. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.